A very warm welcome to you, and thank you so much for joining our Homeopathy 24/7 podcast. We are going to be speaking to an array of international guests who will share their knowledge and experiences of homeopathy with you. We will discuss all types of subjects such as remedies, symptoms, and stories of health. No matter where you are with your homeopathic journey, we aim to inspire you on your quest to natural health and living. The podcast is brought to you by Mary Greensmith, the founder of Homeopathy 24/7, which is a global platform connecting you with a homeopath wherever you are in the world, 24 hours a day. So let's get started with today's chat. Please welcome Mary Greensmith.
Thank you so much for joining us today. It's so lovely to see you all, and I'm very pleased to be able to welcome back Dr. Varsha M. Khurana. Welcome, Varsha. Lovely to see you.
Lovely to see you, Mary. It's been a while.
It has, and it was a beautiful sunny day, I think, last time we were talking together on a podcast. So thank you so much for coming back in. And today, I think we're going to talk about pregnancy. Is that right?
Absolutely, yes. We are ready to talk about pregnancies and how we can support women through and through, only with homeopathy as well.
We often get asked, don't we? Can we use homeopathy whilst pregnant? Is it really safe? So I think that's a good place for us to start today.
Yes, I do think so, because these kind of questions come a lot in the Facebook groups as well, where people aren't sure whether this is a safe modality during pregnancy. But I don't know what to say to that usually, but I would say that I don't know what is safer other than homeopathy, because that's the only thing I have ever used in my pregnancy or otherwise with my patients, and quite successfully so. So I don't know how to even answer that question. How people don't even know about that modality is kind of surprising to me, to be honest.
Yes, absolutely. Because, with over 200 years of using homeopathy, it's about time people knew about it, really, isn't it?
Totally. And that's what we are here to do, right?
So let's just begin with then, what can it be helpful with? I mean, are there certain things that you can use homeopathy for? What is it that you would be looking, oh, well, let's have a look to see if homeopathy would work for that, because we know it's safe?
So where do we start, Mary? This is such a wide array of, symptoms or conditions in pregnancy that we can actually apply homeopathy for. So please enlighten me. Where should we start? Let's start with the first trimester.
Yes, let's begin there. When people are just finding out, perhaps, that they're pregnant, perhaps they're suffering from morning sickness, perhaps they're feeling absolutely grotty. What can they do?
So yes, so morning sickness is something that we successfully use homeopathy for. So many remedies, like a specific remedy that comes to my mind is Symphony carpus, which is a specific remedy for morning sickness during pregnancy. Then obviously the regular remedies like ipecac and nux vomica and arsenicum, and so many others that we use, so safely during pregnancy, during that first trimester as well. And I don't think I ever needed to use any antiemetic with my pregnancy patients. I've not seen that the remedies fail at that simple, condition that is usually existing in the first trimester with a lot of women's cases. So I do think that that's somewhere we can begin with.
And just remind us with some of the different modalities that might point somebody to one particular remedy and not another. How would they decide whether they need one remedy or a different one?
Well, that is something that's the complicated part of homeopathy, right?
Yes.
With the modalities and with when is the nausea happening? Is the vomiting making the nausea better or not, right? If the vomiting is especially happening, excuse me, on waking up in the morning, or is it happening at night? All of that, points to different remedies and different prescriptions. So I think getting yourself a very basic book on homeopathy could also help with that.
Yes, yes. So absolutely. So finding the symptoms and finding how it is affecting you, when it is affecting you, how you feel about it, what difference it makes to you, that all points to particular remedies. So you need to be reading all of the information about all of the remedies and choose the one that suits you best of all.
That's right, because the sheer range of remedies applicable is too many. For me to be saying that use
Yeah.
this remedy or use that remedy is absolutely unfair
Yeah.
and illogical, in the homeopathic sense. So that is why I cannot just point to a few remedies here.
No, that's right. And I think a lot of people perhaps forget that we've got so many remedies and each one has a different picture. And one of those remedies will suit you. So we need that whole picture to find it.
Yeah.
Another thing that I think of with the first trimester and often have people come to me is because they have experienced miscarriages before in previous health. Now,
Yes.
obviously, for us, we'd like to start working with somebody perhaps before they become pregnant, but we can still work on making sure they are as healthy as possible at this stage, can't we?
It's always better to start a couple of months before, if there is, especially if there's a history of miscarriages.
Yeah.
Uh, but at the same time, even if there is no history of miscarriages, I would suggest to start a few months before, when you are planning to, conceive.
Yeah.
Just a few months prior, if you're working with a homeopath, there is a good chance of optimization of uterine health and just making the entire environment in the body absolutely ready for a healthy pregnancy. So working with a homeopath is not the only thing, of course, at that time. There is a lot of, your lifestyle has to be, I think modified as well.
Uh-huh.
It's it's just never about perfecting everything. We are not trying to be perfect with our diet, with our exercise, with our remedies, but at the same time, just having like a joyful environment overall, physically and mentally. If you can just try to encourage that mindset, I think even that helps a lot in a healthy conception.
Okay, so tell me a little bit more about because obviously that's what we're trying to do, isn't it? Help people be as healthy as they possibly can, so that their bodies are able to go long term through a full term pregnancy. Um, so how are we doing that? When somebody comes to you as a homeopath, what are you doing in order to help them be as healthy as possible?
See, we are basically looking at everything that is going on with them at that stage. Like, what are they worried about right now? What are their stresses? What are their life circumstances in that moment? Like, let's say I'm having a consultation with someone today, then I have to ask them what is bothering them today. You know, and there are women who will get pregnant when they are in grief due to something else. There are women who would get pregnant after consumption of alcohol, after consumption of drugs. Also, these days, we get those kind of cases. So, or maybe after a strong course of steroids that they have taken. Anything could be in the history. But we are just trying to, how should I put it? Just the detox is not, I don't want to use the word detox sometimes, because it's I think it's oversimplification of something. But at the same time, just handling with whatever could be a block for the healthy development of the fetus is what we are trying to do. It could be an emotional block, it could be a physical block, it could be a simple drug block, that is still a drug that is still there in the system. So we are trying to do whatever is needed absolutely in that, at that stage of their life.
Okay, so wherever the energy is, whatever's happening at the moment, you're taking this into consideration as well as previous history so that you've got an idea of how they're reacting to things around them and their body reacts as well. So taking all of this information into consideration, obviously, is a very strong point that we use with homeopathy for constitutional prescribing. And we know that what we're doing is stimulating the body, perhaps to be as strong as it possibly can. What about if they have a specific area that they are concerned about, or they've had notification that perhaps their balance, their hormone balance isn't quite right, or their vitamins and minerals is low on certain points? Can homeopathy help with instances like this?
Particularly, yes, if there is a particular vitamin deficiency, we can work on that. Our problem is in those cases that the body is not assimilating that particular vitamin or mineral. The body is not assimilating well. That is what I'm trying to say when I say we are trying to optimize the body and make it ready, for a healthy conception. And that is why the suggestion for starting some treatment prior to the day of conception. Just give us some time prior to that, and we should be able to help you better. I'll give an example of this particular case. Recently, this was a very young female, and she couldn't conceive due to some reason. The reason was extremely vague. Nothing was detected on the tests, nothing came in the ultrasound, nothing on the partner's, sperm analysis as well. So, there was no specific etiology to the case per se. And this case came to me, it's been 8 months now. And even I was thinking that, what is really going on? Why is this woman not able to conceive? So when I just went into the history and the general discussion about health that we always do, the woman told me that she was getting recurrent infections and high fevers since about 2 to 2.5 years. She was suffering from regular high fevers and recurrent infections in the body. So the fever would just come, it would be a high fever for 2, 3 days, and then she would be all right. But then again, such a fever would come, but very high. It would go to 103, 104 Fahrenheit. And that was happening quite regularly.
Mm-hmm.
Now, you know what, Mary, this is something that you go to a gynecologist, she would not be able to correlate uh, anything related to fertility to this kind of a history.
No.
But for me, it became a point of prescription.
Yes.
So I just, as we all know, as homeopaths, we know that when there is such a history of infective fevers again and again and high fevers, we can start with the remedy pyrogenium. So I just used, I think, 2 courses of pyrogenium with her, barely 6 to 8 doses. I feel 8 doses probably over a period of 2 months. And I think in the second follow up or the third follow up, she said that it's been 4 months, 3 to 4 months, I've not had even a single fever. So that septic condition in the body, wherever the septic foci was, we didn't know where is the septic focus, why is this fever coming. Nobody knew. She would just take some paracetamol or she would just take some ibuprofen and she would be fine and she would go on with her life.
Yes.
But there was something off about that. Why is this happening to someone again and again? And the moment that stopped, and I think she tried to conceive about 2.5, 3 months after that, and she could conceive successfully because that was the only blocking, factor in her case.
That's incredible, isn't it? To think that just by listening, just by understanding what else is happening, you are able to help with the fertility and conception, and therefore through pregnancy as well.
That's what I'm trying to usually talk about, that it's impossible for any homeopath to actually understand what's going on in a particular case and how much time will we take to help the case. It's impossible to say.
Yes. Yes.
This kind of a history is something that can be dealt with. There could be something tomorrow which I probably won't understand that or correlate. But it's very important to correlate the entire picture of the being.
So what you're actually saying is that there's a lot more to your health than just the symptoms presenting. It is not the symptoms presenting that needs to be addressed, but it is the reason why they are there.
Yes.
And one thing is very related to the other thing. And pregnancy, obviously, conception is such a brilliant way to see that, because it's quite easy. Well, no, I didn't get pregnant before. And yes, I did get pregnant afterwards. It's lovely results, isn't it?
Yes, yes. And to be very honest, I wasn't very surprised. I actually told the patient that once these fevers resolve, you should be able to conceive because there was nothing else. There was nothing else that was off with her health.
Yes, yeah.
And it happened as it is. So all I'm saying is that there are some cases which can come quite clearly to you, and some can be very muddled up. Some can be, confusing as well. It's never, it's never the same path in every case.
And what a brilliant explanation of homeopathy as well, because everybody is going to need something different depending on whatever else is there.
Yes, absolutely. We have to individualize. We keep using this word individualization like that,
Yes.
and some people are irked by that probably. But I'm sorry to speak, homeopathy cannot work without that individualization of the
No.
case.
No. And I know that people quite often come to us with a diagnosis, or with I've got this, or with I've got gestational diabetes, or other things during their pregnancy as well. So I should think we have to address them in exactly the same way by understanding the whole picture.
Yes, and using remedies accordingly. It's never gonna be one remedy, one folliculinum to be given to everyone. I hear these kind of things as well. Absolutely, these remedies can be supportive in, enhancing fertility. But if there is something more, if there is something deeper, we need to address that. Otherwise, these remedies will not be yielding the result that we want.
Because at the end of the day, our bodies are very intelligent, aren't they? And they're not going to conceive if the body isn't ready to hold a full-term pregnancy. So it's that's part of the job. And then, but okay, this is a complex question. If somebody has had some problems later on in pregnancy before, is that something that can be addressed before conception in further pregnancies?
Again, what kind of problems?
So
Like, give me an example.
yeah.
I'll try to answer that.
So if, for instance, they had experienced postnatal depression or gestational diabetes, or something later on in their pregnancy that just comes during pregnancy or after, obviously in the case of the depression. But how can we help people that have a history?
This is very difficult to answer again without knowing the case, but at the same time, just that overall approach as to what's happening. And also, what I want to say here is that every pregnancy in the same woman will also be different.
Yes.
So we should not actually have the mindset that, okay, if I had postnatal depression in my first pregnancy, it's going to happen again.
Okay.
It just might not happen.
So we're taking the symptoms that she is experiencing now and the feelings she's got now to take her through this pregnancy.
We cannot predict that this is going to happen again. I myself, if I think back, I had postnatal depression in my first pregnancy and after my first delivery and my birthing process. But then the second one, there was nothing of the sort.
Okay, completely different.
It was completely different.
Yes, yeah.
But there are some things, like if there is there's a history of miscarriages, then yes, that needs to be addressed.
Okay.
Needs to be taken care of. Like I'll tell you this recent one more woman who worked with me, she came to me for the fertility issue that she said that I'm having miscarriages. So I started with that thinking that this is a fertility issue. And she just barely 1 month into treatment, she conceived, right? And then it was like I didn't have time to deal with that before.
Yeah.
I didn't have enough time to deal with that. So I told her that I have to, or we have to deal with that now during the pregnancy by keep supporting you with homeopathy during the process. And she shifted from fertility to the pregnancy package, or however I do it, like the package that I offer. And she just shifted to that. And when we continued with that, right now she's in her 8th month or something.
Okay.
So it's not that, see, again, it's not going to be the same in every case. I can't say that, okay, if you will not work for 6 months prior to that, we'll not be able to help you. It's not like that also. But yes, that is ideal situation. We would suggest that ideally. But even if you have conceived and you have such a history, even at that time, if you seek support, we can support you.
Still help. Yes, it's so interesting, isn't it? And of course, I often say, just relating it back to people perhaps where the family has got an infection and they say, well, can I use this remedy for everybody in the family? And they say, no, not for the ones that are already having homeopathy, because, we're working at building their immunity and helping them in a way that's just understanding. It is hard to understand, isn't it? That, the remedy is not for one thing, it's to match one person. Yeah. So tell me a little bit about your packages and how you help people through fertility and through pregnancy, because obviously that in itself can be quite complex.
Okay, so usually, because I try to deal with infertility in my practice, I start with a fertility package, which is an individual package and a couples package. So if both the partners, again, ideally you want both the partners to have good health when you're conceiving.
Yeah.
But let's say if only the woman has the main issue or the male partner has the main issue, even a singular person can seek support. So there are both those options, and it lasts for about 6 months or so, just one package. And usually in that time, on an average, I would say that, you can go into conception about that time, and then the pregnancy package can start. So when I talk about pregnancy packages, I have different inclusions in each package. One would be just to focus on the mother's health and the fetal health constitutionally from the bigger perspective, not covering the acutes. The acutes, as in any fever that comes during pregnancy, any backache that comes instantly, any headache that comes, so that won't be included. But then there is a package which includes everything as well. And then also the package includes your labor preparation, your birthing preparation also is included in that. So it's basically like I'm going to be with you throughout the journey of the pregnancy, and I'm going to be helping you so that we can minimize the use of conventional drugs during pregnancy. That's the aim, actually, to keep it natural and to not cause any harm. If we cannot, see, that's what we always read also, that do not cause any harm. If you can't do any good, please don't cause any harm to the patient. So that is our motto always in homeopathy as well, that we are just trying for it to remain as natural as possible, especially during this precious stage of life, which is pregnancy. So all of that in the package, as well as with homeopathy, we can cover some familial tendencies as well, like any familial predisposition that is coming from the ancestors as well. We can cover that with certain remedies, certain deep acting remedies as well. So all of that is a part of the package.
Okay. So it's quite interesting, isn't it? Just understanding then that to see a patient right through that whole process, and to understand, okay, I'm going to walk with you along this journey so that you are as healthy as you possibly can be.
Yes, I keep meeting them every 4 to 5 weeks, or even sooner if they need me for something.
Uh-huh.
And there was this one patient who actually signed up, and then she was like, I'm embarrassed to email you every 15 days. But then she was on an all-inclusive package. I was like, you have to email me every 15 days.
Yes, yes,
If there is something that's bothering you, you have to get in touch with me. That's why we are doing this. Please don't take any ibuprofen. Please don't take any painkiller. You
yeah.
know, that's exactly what we are trying to avoid
That's
in
right.
through that
And
package. Yeah.
yes, and if you've got that facility, you've got that hand holding and you've got that feedback, then it's going to really help you through this process. It sounds like a lovely idea, Varsha, and we'll definitely put the links down to your packages underneath so people can come and ask you questions and find out a little bit more how you're helping people. What a brilliant job that you do. Thank you so much.
We all do a brilliant job, I'm sure, on our team, the H24/7 team anyway.
We are so lucky, aren't we, to be able to work with so many great homeopaths, and we all just love what we do. Thank you so much for coming in and talking to us about it, Dr. Varsha. Lovely to see you again.
Thank you, Mary. Thank you for having me.
I do hope you've enjoyed these episodes, and I do hope you can subscribe to our channels. Now, there are various ways for you to listen to our podcast or watch it on video on YouTube. So whether it's iTunes, Spotify, or YouTube, please do subscribe and please do leave us a review. If you leave us a review on these platforms, then more people will see our podcast. We just want more people to share the joy of homeopathy. It's a choice that everybody should know about. Please do everything you can to help us help more people.
We hope you enjoyed today's episode and look forward to listening to our next one. Please don't forget to follow our podcast on your chosen channel, and please do leave us a review so we can continue to share homeopathy with as many people as possible. If you do have any questions, please do reach out to us on any of our social platforms mentioned in the show notes. We at Homeopathy 24/7 hope to empower you on your natural health journey.